Hello, and thank you for joining us tonight for our free webinar, Acupuncture plus CBD, Clinical Protocols for 6 Case Studies, featuring Dr. Kacy Korczyk. My name is Jeff Bloom, Education Marketing Manager here at L.A.C. OMS. For over 40 years, L.A.C. OMS has been striving to promote the growth of the acupuncture industry by providing quality products, great prices, and the best customer service, as well as supporting the many schools and continuing education efforts available. With our free webinar series, we intend to provide free educational opportunities taught by some of our industry's most renowned practitioners and educators. I would like to take a moment to acclimate you to the webinar room. To the right of the video screen, you will see 3 tabs: Chat, Questions, and Polls. To chat with other attendees or to communicate any technical difficulties, please use the Chat tab. For questions of our guest speaker, please make sure to use the Questions tab, and then we'll get to them at the end of the lecture. Please note that each webinar is recorded, and immediately following the conclusion, you will all receive an email with a link to view the video on demand and a copy of the slides. And you may always visit our blog and use the free webinar tag to find all of our previously recorded events. From sports acupuncture to neuroscience to Chinese herbs, you'll find something interesting for every practitioner on the L.A.C. OMS blog. Now for our featured speaker. Dr. Kacy Korczyk graduated from West Virginia University with a Bachelor of Arts in Psychology, then received her Master of Science in Acupuncture at Southwest Acupuncture College in Boulder. During her studies, she had the incredible opportunity to study in Harbin, China at a university hospital. After graduating, she moved back to her hometown of Beckley, West Virginia to continue sharing her passion and being an advocate for evidence-based integrative medicine. She opened On Point Acupuncture in 2014 and has since expanded multiple times, and after adding new modalities to incorporate more whole health techniques to her clinic, she renamed her practice On Point Health and Wellness. Her company was also recognized in 2019 January edition of National Geographic. She recently received her doctorate in acupuncture from Pacific College, specializing in orthopedic acupuncture, and this program afforded her the opportunity to expand her horizons and become increasingly aware of the combination of neurofeedback and acupuncture in treating chronic pain and neurological issues. Please join me in welcoming Kacy Korczyk.
Thank you so much. I'm so grateful for L.A.C. to asking me to participate in this webinar, and I'm excited to share these case studies with you. I want to start with saying I'm not a salesperson. I absolutely love acupuncture and I love fixing people, but I am also extremely impatient and want to get people better as quick as possible and also give them the tools to maintain that relief without having to come to see me over and over for the same issue. I have multiple modalities in my clinic that I add to my acupuncture treatments that help people feel their best. And CBD has been a huge part of that. And it also gives my patients the freedom of self-care. I also enjoy the business side of having the acupuncture business and wellness clinic. And my clinic is very busy. We have a lot of moving parts. We offer massage, neurofeedback, hyperbaric. We have an infrared sauna, personal training gym, yoga. We have a lot of stuff, and we try to use CBD in almost every aspect of that, especially the acupuncture and massage. And also CBD is the best seller in my retail section by a long shot. So it's great for adding more income to your practice. And if I can create a wellness clinic in West Virginia and sell CBD in the Bible Belt, then I think anyone in this country can do it. So if you're interested in helping patients feel even better than they do with just acupuncture alone and adding another source of income to your practice, then I hope you can get something out of this chat. I'm going to go over 6 of my most impressionable case studies that involve CBD on some extent, and I'll be glad to answer questions at the end. Okay, my first patient is a 39-year-old female, and she has very high anxiety and ADHD, difficulty falling asleep and staying asleep. She has neck and shoulder tension. She is a wedding photographer, so she is constantly carrying around heavy equipment and dealing with very stressful situations. She also has poor digestion because she is a mother of 4 kids and she is eating on the run. She homeschools 2 out of the 4, and she has a very type A personality, very busy, constantly stressed out, and basically needs all the help that she can get. TCM diagnosis is spleen tissue with heart fire, tongue and pulse wiry and slippery. Her tongue is dusky. It's got some scalloped edges, center crack to the tip, and a red tip. For acupuncture, this is a typical treatment that we like to do on her. It's SI14 into the levator, UB10, 15, 18, 23, kidney 6 with heart 7. I love as a calming combination. And then some auricular points, the occiput, shinmin, point 0, heart, and liver. And then she loves cupping and gua sha, especially on the upper neck and back. And we use CBD, the massage oil level 2, on her for this. CBD treatment, she is obsessed with the calm gummies. That's the full spectrum hemp, Charlotte's Web. It also has lemon balm in it, and that also helps her sleep and relax. She takes these as needed. A funny story about this, I was actually a guest at one of her weddings she was photographing, and she had to deal with this awful wedding planner, and the bride was kind of a bridezilla. And she messaged me and she's like, I do not have calm gummies and I'm going to lose my mind. Can you bring me some to this wedding? So I literally wrapped it up like it was a wedding gift and like handed it off to her right after the ceremony. And she was very grateful. She also carries around the level 5 CBD stick, the CBD clinic stick in her purse, and she applies that when needed. Results, we've been treating her for about 8 months. She is now able to maintain a regular sleep schedule. That's 6 to 7 hours a night straight through. And before she started treatment, she was only getting about 4 hours off and on every night and waking up feeling very unrested. Now she only needs acupuncture around really high stress events. That's about every 8 to 10 weeks. And she does really well with managing her sleep and anxiety symptoms with just the CBD at home. And she also does get massages too, kind of regularly, but we use the CBD clinic massage oil in those as well. Next, this is one of my very sweet veteran patients. He is 68 years old. And he was diagnosed with Parkinson's disease about 5 years ago. And he has a steady tremor, or had a steady tremor, I should say, in his right arm and head, also coupled with poor memory, and he would get dizzy spells. He had a history of a stroke, and that's when some of the paralysis started. And then a few years later, he was diagnosed with the Parkinson's, which then this tremor started. And then after Parkinson's, he's actually started having some infrequent seizures. Personal history, he is a chronic smoker, about 2 packs a day. Off and on, he's quit for like a month at a time here and there, but he's done that since he was 17 years old. He also has very dry skin. And then TCM, the tongue, very dry, multiple cracks, really tiny cracks, very red. Pulse is wiry, rapid, and deep. Diagnosis, wind in the gallbladder channel, kidney yin shu, and liver blood shu. Acupuncture is gallbladder 31 for the wind, 41 for the wind as well. And then kidney 6 with liver 8 and C shin kong. And then auricular, we do this bilaterally. Shinmin, some brain points, 0, autonomic, and kidney. And we've been treating him for about 2 years. If anybody here is familiar with treating veterans and getting referrals from the VA, then you can understand how frustrating it can be. So when I say we've been treating him off and on for 2 years, it's because they only approve about 12 treatments at a time. So we'll get him to a really good spot with the acupuncture. And we did that for a while. And then we realized the VA would sometimes take about 3 to 6 months to reapprove sessions. So we knew that he needed some supplement help at home. And with the VA, there's always a risk of them testing positive for the THC. And then that can cause a lot of issues with their benefits, disability, and things like that. So that's something that we're always cautious about. But he was so miserable to the point where he was willing to risk that. And so we put him on the 17 milligram CBD. He likes the mint chocolate flavor. And he does a full dropper 1 to twice daily. And his results, haven't seen him in like 2 months, but he was able to maintain that for about 8 months now with just the CBD at home, with acupuncture here and there. He's reported 90% improvement in his symptoms. Even his neurologist at the VA was extremely impressed with the combination of acupuncture and CBD, because he did, I think, a Zoom consult with his neurologist because he's pretty far away. And he's like, "Do you notice anything?" And his doctor's like, "Oh my gosh, you're not shaking. Like the medicine's finally working." And he's like, "Nope, it's been trying acupuncture and doing CBD." And he's like, "Great." And he, if only that neurologist had any sort of power over him getting approved for acupuncture more regularly, then we would be in even better shape. But we've been able to maintain this at least above 50% for the past 2 years almost. So pretty awesome. Okay, this was a simpler case. This was a 19-year-old male who could basically heal very quickly and in very good shape. He's a semi-pro baseball pitcher. And he came in a few months ago. He had broke his left hand, and also strained his right shoulder and had some pain into the right elbow as well. He's right-handed, which is an issue if he's trying to pitch. So TCM, very simple, chi and blood stagnation. Muscle testing, we did quite a few. The empty can test was the most weak. So we definitely went over getting into the supraspinatus pretty nicely here. SI14, SI12, 2 points into SI12 to get into the supraspinatus, link those two with some E-stem, and then Li15, and some motor points, which were the subscapularis, serratus, and infraspinatus. And with those, I just did a TENS pin for that. And then we did a cupping and gua sha combo on the shoulder and on both forearms, actually, for that fracture and the pain into the elbow. Let's see, CBD treatment, super easy. We gave him some topicals, CBD level 4, and then the patches, which are level 4 as well. So that's menthol, camphor, CBD, and he used those at home, and we would use them in the clinic with the gua sha and cupping that we would do. And results, he got back to playing really, really, really quickly. He was able to play and pitch about 2 weeks after acupuncture twice a week with cupping, gua sha, and then also the CBD topical for home use. He would apply every 4 to 6 hours. He stayed on top of it pretty well. And then he's been pain-free. It's been over 5 weeks now, and he's doing really great. Okay, this was one of my more complicated cases. This is actually my future stepdaughter. She unfortunately had cancer 5 years ago when she was 12. She's now 16. The cancer was in her spine, so they did a spinal surgery on her to remove the tumor, which was pretty large, and she had to have hardware from basically T1 down to L5. She had some sort of hardware applied at each vertebrae. From that surgery, her left leg and waist are pretty numb. She's able to walk, but she has a lot of atrophy in the left leg, and she has a little bit of a limp whenever she does walk, if you pay really close attention. She also has not a lot of control over her bladder. She has to cath when she urinates. From all of this, she has some anxiety. She also struggles with ADHD. She had to go through some radiation. So a lot of that ADHD and anxiety, she had some memory loss from some of her younger years. That's probably from the radiation. Also some poor digestion. She's pretty tiny and doesn't have the best diet. Occasional insomnia, and she runs really hot. But she is in remission, which is wonderful. And let's see, TCM diagnosis, spleen tissue and kidney tissue. Acupuncture, she loves acupuncture. SI14 to get into her shoulders. She actually has a lot of tightness. Whenever she first came to see me, she actually had this whole list of, crazy stuff that she had been through. And she's like, man, my shoulder is killing me. And I'm like, that's the first thing you have to complain about? Okay, well, let's fix that shoulder. So from that hardware, her shoulders are extremely tight and knotted. So we get into those really well. SI14. We also do Ba Feng on her left side, because from where her leg is numb, her toes kind of curl under. So we like to release that. Gallbladder 34, spleen 3, UB23 for the bladder, SI3, and UB65 just for some spinal health. And then she loves cupping. She actually saw on TikTok wet cupping and wanted to try it really bad. And since then, that's been the best thing that helps her with some moving cupping with the oil before, and then we clean it really well and then do the wet cupping just stationary over the levator around SI14. And from where school is starting back, she's having to carry a lot more, so it's a lot harder on her upper back. So we're doing this protocol just a little bit more frequently. However, we do have her on some CBD regimens. She loves the sleep gummies. She claims those help her just relax enough to fall asleep and stay asleep. The CBD patches level 4 on her shoulders, she really likes those, and that really helps relax those muscles. She has the CBD level 3 at home that she uses as well if she doesn't have any of the patches or just feels like doing that. She likes to have a lot of tools in her tool belt. We did acupuncture about once a week for 10 weeks, did cupping about every other treatment, and then she does CBD at home for maintenance. Right now, we're probably treating her every 3 weeks with acupuncture and cupping. She's also doing a lot of other stuff in the clinic as well. She's doing the on-up foot soaks, hyperbaric oxygen chamber, and we actually just started doing some neurofeedback on her as well. But she is reporting about 60 to 75% improvement at home just by using the CBD. Let's see. Yeah, her shoulders are not as tight. Sleep anxiety both diminished. She's sleeping about 7 hours a night on average when she's not staying up and watching TikTok. This flares up right about the 3-week mark, so it's easy for her. She'll come to me and say, I need treatment. And luckily I've got all my tools here at the house, and we just kind of treat her here now, which is nice. So yeah, about 75% improvement with pain. With all the hardware in her spine, I didn't really get her hopes up. I think 75% was actually a lot better than what we originally even said. So 95% improvement with digestion, anxiety, and sleep as well with the treatments. And that's been able to be maintained at home for the most part. Okay, this patient is a 45-year-old female. Migraines and insomnia were her 2 main complaints. She's had insomnia for about 2 years. Chronic migraines, about 15 or more years. She gets about 1 to 3 a week, and these are pretty severe, where she has to go home, get in a dark room, not eat or drink, gets nauseous, and lots of other nasty symptoms. She is a dean of a college, so she is very busy. She's also a very big perfectionist. She had a history of an automobile accident about 17 years ago, and she's also had multiple head injuries, which has not helped the migraines at all. TCM diagnosis, liver qi stagnation, acupuncture. This is pretty regular treatment we do on her. Gallbladder 41, the tongue beside 3 mile points, which are great for headaches and migraines. Lingu Dabai, Si3, and Yin Tong. Auricular cervical spine, liver, 0.0, Shinmin, and insomnia. And for CBD treatment, she really likes the calm gummies for sleep. And I want to note right here, the calm gummies, I actually really like for sleep for people that melatonin does not work on. That's a typical question I ask when people come in. If they have insomnia, I've asked if they've tried melatonin. If they say no, it doesn't work for me, or it makes me feel weird the next day, things like that, then I always kind of direct them towards the calm gummies instead of the sleep gummies. And those tend to work really, really well for that type of person. We also gave her, I wanted her to have a few different things because I felt like her migraines and insomnia were all kind of complicated and came on really weirdly. So she takes the calm gummies every day for sleep. She also keeps the 25 milligram CBD tincture with her for migraine onset, and she'll do a full dropper whenever she feels a migraine coming on. She typically gets some auras or has some light sensitivity, nausea, something like that before they hit. And then also she loves the level 4 on her neck, and she'll even put some kind of on her forehead. I don't usually recommend that because it does have menthol in it, which is a little bit too close to the eyes, but she lays down with that on and she really likes it. Sometimes she'll put like a cold pack on that as well and report some relief there. We have her on a pretty nice regimen at the office, acupuncture once a week. We're doing some neurofeedback on her twice weekly. We did that for about 10 weeks and we started kind of cutting back just a little bit because she was doing really well. And then with the use of CBD at home, of course, for sleep and migraines. Her migraines have been reduced greatly from about 1 to 2 a month. The intensity of the migraines have been reduced by at least 50%. And she was doing Botox every 3 months, I think. And she actually discontinued that because she was getting such great results with everything that we had her on. Okay, this was one of my favorite cases, probably of all time. This guy was super sweet. He came in, his mother-in-law was actually a patient of mine, and she set this appointment up for him because he started having OCD symptoms come back. He had been able to maintain these with Paxil for about 13 years. So when it came back with a vengeance. And he came to see me in February. His symptoms returned and he had to quit his job. He was very angry. He was having the repetitive thoughts, insomnia, depression, and was not doing well, starting to really kind of sink into that depression. So TCM, heart, qi shu, phlegm misting the mind. Acupuncture points we did were gallbladder 41, liver 3, gallbladder 34, pericardium 6, heart 7, yin tong, and do 4. And we actually would do these while he was hooked up to neuro. He was one of the first patients that I did this combo with, and it worked so well for him. We treated him twice weekly for about 6 weeks, and then we went to once a week, and we did acupuncture about every other time with those neurofeedback sessions. CBD treatment, we initially tried the calm gummies about 2 daily, and that just wasn't intense enough for him, I don't think. So he did that for 3 days and didn't really report, and we started him off kind of right away after the first treatment. He took those calm gummies home, and luckily his fiance, or now wife, excuse me, had some anxiety and she loves them, so she gladly took them. But about 3 days later, we actually increased it to the 25 milligram CBD tincture. And a cool note with the neurofeedback that we started doing at the clinic, we found CBD, good CBD should increase theta waves, slow alpha and high beta. And we actually saw this progression with him. And that's kind of close to what acupuncture does for the body too, if you look at research, which is kind of awesome. But it was really cool to see his progression along with the neurofeedback combination. And he did so awesome with this. He stopped Paxil. His OCD symptoms resolved, and he was actually going for job interviews last I talked to him, and he's able to just maintain the results with CBD. We haven't seen him in probably 2 or 3 months. And yeah, he's doing really, really great. Okay, and now I will wait for Jeff and then answer some questions if you guys have any.
Thank you so much, Kacy. That was such great information. I'm just going to bring Jen up on screen. Just give me 2 seconds. All right. And thank you, everybody, for your patience. All right. So we're just going to give 1 second for Dr. Jen Palmer. So she is joining us as the Director of Education for Charlotte's Web CBD products. So she is going to do the Q&A with Kacy, and you guys are going to learn a little bit more and get some questions answered. All right, I will get out of the way.
Hi, everyone. Thanks for joining us. I'm Jen Palmer. I'm a naturopathic doctor, and I'm the Director of Education for Charlotte's Web. And thank you so much, Kacy. That was awesome. You clearly have so much passion for your patients, and those were really interesting clinical pearls. I just love hearing, doctors using this in practice and what happens with that. And also, congratulations. It sounds like you're engaged. So congratulations.
Yes, thank you.
That. Very exciting. I thought maybe we could talk about CBD just a little bit. We talked about ways that you're using it orally and you're using it topically. And so, there is a difference. I just want to be clear with everyone that when you're using it orally, you're ingesting it, it's going through digestive, it's being used systemically through the endocannabinoid system. And that's different than when you're applying it topically. It's only working in that particular local area on the endocannabinoid system of the skin. And then with the CBD clinic products with the menthol and camphor, those are working on your TRP receptors. So they're interrupting, pain sensations going to the brain. So, and the oral CBD that Kacy's using from Charlotte's Web is a full spectrum hemp extract. So that has all, the compounds that are available from the hemp plant, including the CBD and other phytocannabinoids, plus a teeny bit of THC. So you're getting more of like the whole plant effect, which is really different than using something like an isolate or even a broad spectrum, for instance. So it sounded like a lot of times, Kacy, you're using the combination of topical and oral. Do you notice a different effect or a better benefit when you're using them together because you're kind of addressing things from both ends?
Yes, for sure. Like I said in the beginning, I'm very impatient. So when people come in for their first treatment, I'm like, okay, let's come up with a plan and let's get you as best as you can be, as quick as you can be. And usually people that have chronic pain need the combination of both. And that's typically the majority of patients that we see as acupuncturists, at least in my clinic, I do. The baseball player that I treated, of course, his was pretty pinpoint, so he could get away with just using the patch and the cream, very localized. But if people come in, they have a laundry list of symptoms. They're like, my knees hurt, and sometimes my hand hurts, and I get headaches, and this and this and this. And you're like, there's no way you'd have to bathe in this topical to get this to work. And that's just, wasting money at that point, in my opinion. So what I tell people is let's get you on something internal because that's going to have a more systemic reach, and then get topical. And on those bad days where just your right knee is hurting, use that in combo with the tincture, and that'll, kind of get it from both angles.
Yeah, because you need to break that cycle of pain. And so you want to hit it internally to get the inflammation down, which is like a slower process. But it is amazing to give that pain relief that's so quick with the topicals. Yes. I just found it really amazing when we first brought in that company and that brand, how quickly it acts. Mm-hmm. And let's talk about those topicals just a little bit, the CBD clinic topicals. They have varying levels of menthol and camphor, and then they have CBD in them as well. And so we have level 1 through 5, 5 having very potent high levels of menthol and camphor. And then there's like variations all the way down to 1. Is there a system that you're using where you're deciding I'm going to use a lower level or I'm going to use like the really strong one? What's kind of your thought process when you're making that decision in the office?
So with that decision, I really lean on TCM diagnoses and also just constitution. If I get a 90-year-old woman who's like yay big and frail, like on a cane, there's no way I'm going to pull out level 5 CBD and just, load her down with menthol.
It'll knock her over.
Too harsh. Yeah, too harsh. So for someone like that, or like a kid, someone that is not as strong and can handle that much, I tend to go a little bit lower. Now I treat one guy who is a prison guard. He's like 6'4", and he comes in and he's like, could squash me with his pinky. And I'm like, okay, level 5 for you because you just broke up 12 fights last night and you are huge. So he can handle that. He probably needs that much menthol and CBD and camphor to even make a dent. So it really just depends. We keep almost every level in each of my treatment rooms, even my massage therapist. I went over this with them. I say when in doubt, go lower. So typically we use like level 1 or 2 in the treatment rooms. Those are the most common ones that we do use, but we do have the higher ones for people that come in really acute pain. I treated a sprained ankle today and she was 17, so a little bit on the young side. I used level 4 on her, and she had a game tomorrow, so she really wanted to play in that. We were trying to get it kind of better as quick as possible. So yeah, I really lean towards constitution. I don't love to use menthol on really weak constitutions, and yeah,
that makes a lot of sense. And it is interesting because I don't know if you've used like the other kind of menthol camphor topicals like BioFreeze or Icy Hot or things like that. I've noticed that there's something about having the CBD in it that seems to make it last a lot longer, like more like 4 to 6 hours of pain relief instead of like an hour or 2 hours. Has that been your experience?
Yes, for sure. I am not a huge fan of BioFreeze. My chiropractor sometimes uses that on me and I like just start shivering. It's too harsh for me. But with the CBD involved, it tends to A, last a little bit longer, and B, also make that menthol just not as harsh, in my opinion.
That's interesting. Maybe that's what's going on. Orally, the story of your Parkinson's patient, I think, is really interesting because there is some research showing that CBD, it's an anti-inflammatory, and it also seems to be like good for neuroinflammation and neurodegenerative diseases. And so they're starting to look at that for Alzheimer's and Parkinson's. So you said that his symptoms were starting to resolve with that. And he also had seizures. And, that's kind of how Charlotte's Web started, with the story of Charlotte, who had very intractable seizures and nothing's helped her except for Charlotte's Web CBD. And so we know it works really well in the nervous system. So it'd be really interesting to continue to watch that particular patient and see if this kind of halts his progression.
Yeah, for sure. I think it's already doing a really good job at that. Even his neurologist was so impressed. And whenever, and I've got research saved. If anybody wants that, you can shoot me an email and I'm happy to send you. I'm a geek about research, so I keep up with it really regularly. But I'm really good friends with a neurologist in town, actually. And whenever a research article came out about 2 years ago about MS and CBD, I sent it to him just like, hey, I thought you would find this interesting. And in no way this was like a sales thing. I was just, geeking out and just like, here, look at this cool research. And he actually had an MS support group that he hosted. And he asked me, he's like, can you come present on this? He's like, a lot of patients are asking about this. And he's like, I just don't really know a lot. And he was grateful for the research. So I actually went and presented to a huge group of people that have MS, and got a lot of them, even, they didn't come in, some of them didn't come in for acupuncture. their insurances, are kind of iffy with acupuncture, but they can afford to come get CBD. So I get referrals from this neurologist all the time. Even the pet stuff you guys have, I'm linked up with a lot of veterinarians, and dogs that have seizure, those are great. Veterinarians refer to us. So we get a lot of walk-in patients, especially with neurological disorders, to come in and ask questions and get something suited for them, which is most likely, Charlotte's Web.
Yeah, and it seems to be particularly effective for that. That's how I got involved. My dog was having seizures a bunch of years ago, and it cleared it right up. And I was like, I need to really get into this and learn more about it.
Yes.
And so
people will spend so much money on their dogs.
Yeah. Yeah.
So, including me. So
if you're contemplating using CBD for these neurological diseases, the one that Charlotte used was the original formula, which is the alcohol extract one, which is kind of unique and different from all the other brands. And so that one we think has more terpenes, or we know it has more terpenes in it. We think it seems to have more of an effect on the nervous system. And so if you really are dealing with a difficult case of some kind of neurological disease, I would recommend using the original formula, which has 50 milligrams of CBD per milliliter. But it looks like you're having good results with much lower dosage of that, with just the 17 milligrams. So that's great. And maybe you'll have to increase it later or something.
Yeah, I tell people that, let's start off low. And if you ever reach a plateau, then let me know and we can up it.
Yeah, it's possible. I want to address some of the questions here. There's a couple. So he's asking, when taking a tincture, a broad spectrum, so you're using a full spectrum, just to be clear, it says every 12 hours, is the pain level continuous, or do you see it peak an hour after taking? I think he means, does it peak on getting rid of the pain in an hour?
Usually it's actually a little bit quicker than that, in my opinion. If they're dropping it under their tongue, it usually gets absorbed into the bloodstream a little bit quicker than that. So
if you hold it in the mouth and it, if you can keep it in the mouth, and the buccal mucosa will absorb it and it'll go into circulation faster. So that's always a good trick.
So usually within like 15 to 30 minutes is typically when people start seeing relief, and that tends to last 8 to 12 hours, in my opinion.
Okay. Yeah, the research shows that it lasts about 6 to 8 in general, but it's definitely going to depend on the person and individual biochemistry.
Yeah.
Did you have a tip for Morton's neuroma with acupuncture? She said, I tried CBD but didn't get a good effect. So one thing is make sure you're using a good CBD. There's a lot of them out there. Some aren't good.
Yes,
besides that, did you have any other advice for that?
Typically I like to go a little bit local on that. Whit Reeves has a really good protocol, and getting in the spleen channel on the medial side of the foot and doing some stem, and then also like liver 2, liver 3, and doing some stem. I love and heat for that as well. And then there's a few motor points actually in the back of the leg that I'll hit on for that as well. My cat's going to make an appearance. Don't mind that. And Morton's neuroma can be pretty tricky depending on how they got it and if it's more of a chronic issue, things like that. But I've had good success with CBD. Typically, I'll have them do an internal tincture for that with like a really like level 4, level 5 topical, and that tends to knock out a lot of that inflammation, because that's such a ton of inflammation in that one joint. So getting it from both angles is really helpful. But then also stem. I love stem. I'm totally Whit Reeves student, so love stem.
Great. Someone asked if you're using, it says, obviously you're using acupuncture and CBD, but are you not using Chinese herbal medicines in your treatments?
I do. I'm not as big into the herbs as most acupuncturists, I'll admit. But we do have a few like jowls and things like that. We carry a few things in our retail section as well. It depends on the person. Sometimes I'll have them even not mix the two together, but use it alternatively. So like use CBD in the morning and then a Chinese herbal tincture or something at night. So we do carry some Chinese herbs. I don't use them as much as a lot of acupuncturists though.
Somebody asked for the person with the OCD, did the addition of acupuncture make a big difference when added to the neurofeedback? He said the research is indicating that neurofeedback is highly efficacious for some with OCD.
It's hard to say because we started off with the protocol of, hey, let's start neurofeedback and do acupuncture every other time. So would he have gotten just as good a results with just the neurofeedback and CBD alone? That's hard to say, but he did feel a lot calmer, I'll say, after the acupuncture treatments and combo. And the combo we were doing on him was a lot of decreasing the high beta. It was very interesting. He had a lot of like yang. He was very angry. So doing a lot of calming points with the neuro and decreasing the high beta was just a really good protocol in general, I think, for him.
Great. Here's an interesting question. Are you seeing drying or yin deficiency symptoms with the long-term use of CBD products? If so, what diet or herbal remedies are you using to address that?
I can't say that I have, especially with my Parkinson's patient, because he is very dry. He's been a smoker since he was 17 and he's in his 60s. So I don't think that got worse with the CBD, and he's been on it for quite a while. So I'll definitely keep that in mind and see if anything does pop up. For him, we did have him on a probiotic as well, just for the gut-brain reaction. But other than that, we really didn't do anything. In West Virginia, I will say, people are very stubborn and people are very unhealthy. So trying to get people to talk about their diet, of course we try. These veterans that are stuck in their ways are not going to follow through with it. So you almost have to work with people where they're at. So, pick your battles. I haven't seen that with him, and that would be the one case that I would really pay attention to that in. So not that I can see.
So this is a great follow-up question, actually. People in West Virginia, they're more conservative potentially. So do you have like certain talking points that you're using with your patients who may have some reservations about using CBD, or they think it's pot, or, whatever the concerns are?
Yes. I mean, we've definitely been told. My favorite one, we were at a fair. It was like a women's health fair in town, and it's pretty big, like thousands of people come through it. And of course we're, selling our stuff and promoting our services. And this one lady came over and she looked at us and she's like, "You all need Jesus." And I'm like, "Excuse me?" And she's like, "You're selling pot." And like I said, you have to work with people where they're at. So in that moment, you can try to teach, like, "Hey, like, I'd love to send you research on this. This is actually CBD. It's part of that plant, but it's not the part that, gets you high." But we definitely do get a lot of skeptics. One good thing, I mean, I've been in practice for about 8 years here, and I'm from this town. It's nice when you have a trusting relationship with your patients, because when I tell my patients, my patients know from day one, I am very enthusiastic about getting them better. And we set up a protocol that they're comfortable with. And we, talk about everything. I encourage them to ask questions. I give them research. So it's very open.
And you're building trust, which helps.
And you have to build trust. And if I say, like, "Listen, you're in a lot of pain. I think the acupuncture can help you, but I think if we add this in, it's going to help you even more, and you're going to feel so much better." And they're going to say, "Yeah, like, yes, I just want help." So if you explain, like, "Listen, this is not THC. This is a part of the plant." The best part, most people are just uneducated about it. They'll come in, they usually pronounce or have the wrong acronym for CBD. It's like DCB or, whatever. I'm like, "Okay, let's start." So I never like get, in their face or anything. It's like, "Okay, well, let's have a conversation about this. Like, here are the products that I would recommend. we can start here and we can build up on this if need be. Or if you want to go ahead and get like this topical and this tincture, I think this is going to be the best combo for you. Try this out. One thing that really helps is Charlotte's Web makes the samples, especially level 5. I mean, I have a huge container of those level 5 samples, and I'll give them out to people on their first treatment. So I make it very aware on their first treatment, like, hey, try this sample, like cut a really small edge, use it as much as you can, apply it today and tomorrow, and then note how you feel. And then if they come back and they say, gosh, I felt so much better. Okay, well, that was level 5, this is where we can go from there. So I think just building the trust is the biggest part of that, but definitely if people are stubborn and they're, scared to try it, I never I'm like, you need this. It's more like, okay, well, I can tell you're not comfortable with this. Let's try acupuncture for a while. Let's revisit it in 6 treatments. And if you're not where we want you to be, like, I expect you to be 60% improved by that point. If you're not there, then let's talk about adding something else in. So patience and education.
I've heard many practitioners say those sample packets are really a great way to do it, because once they try it, they're so hooked on it and really just receptive after that from trying it.
For sure. Yep, that's definitely the best tool.
Somebody asked, great question. Is there anyone you don't prescribe CBD to? Is there any contraindications that you're concerned about?
I am usually pregnancy, of course. Like, I don't really want to mess with, a pregnant woman if they're in pain. I'll just do some really nice acupuncture and, recommend massage and things like that. Anybody that's breastfeeding, I never want to give menthol. So the Relax one that CBD clinic just came out with, it doesn't have any in the menthol in there. That's a really nice one to use for breastfeeding moms. And then the veterans, anybody that's on any sort of program where they do test for THC really regularly, even though there's such a small amount, I don't want to be the person that is responsible for someone losing their job or benefits. So I'll always make that aware, especially my veteran patients. And a lot of them are very fearful of losing their benefits. So they'll just come out and say, like, no, let's just do this.
And that's a real
totally
concern. You can potentially test positive for THC depending on if you're taking a lot of it for a long period of time, depending on your metabolism and things. It is possible to test positive. So it is something to be aware of if someone's going to lose a job or some kind of important benefit for that. You may want to avoid that. And we actually do have a THC-free product, so you can use that one for those people instead. It's a real concern. So somebody's
kids. I should say kids. Unless it's like we've got some, kids that have some seizures and things like that, that their parents are very open to using it. So we will for those types of patients. But if like an 8-year-old comes in and they're, pretty mild symptoms, I'm not going to push CBD on that kind of person. But unless the parents ask about it. ADHD, I love the Calm gummies for, but like I'll mention it to the parents, and usually I'll have them literally start with like a half of one of the Calm gummies. Start from there and let's build up if need be.
That makes sense. So somebody says, I'm not familiar with the products. So when you mentioned using 25 milligram tincture, how is that dose? So the Charlotte's Web products on the bottle, there's usually a number. So it's either going to be a 17 milligram, a 60 milligram, or the original formula, which is 50 milligrams. And that's the amount of CBD per 1 milliliter, which is a full dropper. And the droppers are marked so you can measure it. So that's how you dose a tincture, is through, it's the amount on the label per mil. And so sometimes people start with lower amounts and kind of increase it and play with it to figure out what works for that person, because, everybody's different. And some people might take 100 milligrams and some people might be sensitive to 5 milligrams. But I would say like an average is about 25 to 50 milligrams a day or twice a day. And then the gummies are 2 gummies is 10 milligrams of CBD. And then one of the calm gummies have the lemon balm, and then the sleep gummies have the melatonin. And there's something magical that happens with the melatonin and the CBD in those gummies. Like, people love them, and they just work so great. And it's not the same as when you take melatonin separately and CBD separately. So I don't know what it is, but they're popular, right? People love them. And then somebody's asking about the migraine patient. And she said she uses calm gummies every night. Do you think the dosage in them taken daily for sleep contributed to her improvement with respect to her migraines also? So we know that the topical part helped with the menthol and camphor, but do you felt like the internal part was also contributing?
For sure. I think her just getting better sleep with the calm gummies probably helped her migraines and anxiety and mood in general. Yeah, 100%. Yeah,
there's a theory called the endocannabinoid deficiency theory, which is basically saying like our body doesn't make enough of the endocannabinoids, which can cause a deficiency, just like a vitamin D deficiency, and it can lead to a lot of chronic illnesses, things like chronic fatigue syndrome. Migraines is one of the things that's possible on that. If you get a chance to read the Ethan Russo papers, he wrote about that. He's like one of the premier cannabis researchers. He writes about endocannabinoid deficiency syndrome. And so some of those really tough to treat chronic conditions may be linked to that. And so that's why taking CBD can help, because your body's just not making enough of the cannabinoids internally. Somebody's asking about drug interactions, which is also, something we have to consider. So she has patients who are on prescription medications for various things. Do we have cautions for these? And I don't prescribe herbs for anyone on a blood thinner. So yes, the CBD is metabolized in the liver through the CYP enzymes. And so through a couple of specific CYP enzymes. And so you have to make sure, what CYP enzymes are the medications being used, because if they are both using the same enzymes, then it might require adjusting the amount of the drug either up or down, actually, depending on, what drug it is. And it's a pretty complex formula, but projectcbd.org has a great downloadable handbook about that. And they kind of spell out what enzymes are specifically being metabolizing CBD, and then what drugs you should look for, and then how you can actually adjust the CBD or the medication dosage so that you can do both together. So you can do both together. You just have to know how to fudge it and make sure the person is doing the CBD consistently, as long as they're taking the medication, so that they can adjust it appropriately. Do you have any comments about the drug interactions, or have you had pretty good results with
usually
that?
I just tell people not to take it like with something else, like don't take it at the same time. Take it about like 2 hours or something after that to give it time to metabolize separately.
Oh, that's great. So you've never had an issue as long as you do that?
No.
That's an easy thing. That's easy to do it. And is it possible to test positive for THC with just the topical? No. So you don't absorb the CBD or THC. There's no THC in our topicals, but you don't absorb THC or CBD systemically when you apply it topically, unless you're using some kind of different transdermal technology, which is not what we have. We just are using it, topically. So you don't need to worry about drug testing when you apply it topically. Okay, any other questions? It looks like we're just about out of time, but I think we covered everyone. Is there anything else you want to throw in there, Kacy, or?
I don't think so.
Okay, you covered a lot, and I really appreciate all the clinical pearls.
Of course.
I think we'll probably share the recording or PowerPoint with people, Jeff. Is that correct?
Absolutely. So everybody who is still here, you will all get an email 5 minutes after we end, and you'll have a link to the recording. You'll also have a link to view the slides separately. Just thank you so much, Kacy, for all of that great information. And Jen, thank you so much for asking such wonderful questions and really engaging with Kacy. That was really great info. We hope everybody had fun tonight. Actually, next week on Thursday, we're going to be hosting Whitfield Reeves and a panel of his apprentices for a really wonderful webinar, which is going to be Acupuncture Sports Medicine Beyond What You Learn in School. So check out our blog for registration for that. We just, again, thank you to everyone. Thank you to Charlotte's Web and CBD Clinic for helping. And thank you again, Kacy, for all of your time and information. This was wonderful. And hope everyone has a wonderful evening.
Thanks for hosting this, Jeff. We appreciate it. And Kacy, thank you so much. It was wonderful to hear you share your information.
Thank you, guys.
Thank you, everybody.
Bye, everyone.
Bye.